In the beginning of COVID, they shut all the bathrooms down in the gas stations and most restaurants to the public, and I was having some challenges with my bladder. I mean, I was carrying around a plastic bottle and a beach towel so that, I can take care of myself.
Hi, I'm Stephanie Wolf, PA and CEO of the Novus Center here in Studio City, California. And today we have our patient, Chris. Chris is going to share his journey with us and how he found Novus. So first of all, who are you? Where do you come from? Are you from California?
Actually, this is a journey. I live in Malibu. I've been in Malibu over 40 years. And so the way I found you was, I believe, just right off the internet.
So you have an interesting story. You were actually looking for help for erectile dysfunction. Like you said, you're 64 years old.
Well, I mean, there's no question that, the focus of what you do is erectile dysfunction. I did a little inquiry, and it's good technology. The technology outside of your source, it proves up. I mean, it's linear, understandable. There's no woo-woo involved in this.
Yeah.
It's a physical thing that you can do that's not taking drugs that helps you to be healthier and stronger. It's not that big of a challenge these days with all the pharmaceuticals that are available, and that just isn't the healthiest necessarily, wonderful way to go. In my world, it doesn't feel good to me to do that. To be completely frank, this was an alternative.
You were researching,
Yes.
And the reason why you were researching a solution is because you were taking the medications.
Right.
How long had you been depending on those?
Longer than they have been around.
Okay.
I did injectable.
The Trimix.
Yeah, before they were giving anything else.
Did you notice that the more you used these products, the less they were working for you?
Yeah, I don't have a problem at all with that. The functionality seems fine, but I just don't want to put that in my body. It
Yeah.
doesn't feel good.
Yeah.
There's definitely considerable residual effects from it. Sinus issues and things like that. The blue haze. I don't really get that so much, but I definitely have sinus problems from it. And it just doesn't feel good.
Yeah.
You can feel it. You can feel it in your body in an unhealthy way. So.
Low intensity shockwave therapy, believe it or not, has been around since World War II. Mm-hmm. I feel like most people don't really know that. And, it was first brought about for something called lithotripsy. Lithotripsy is actually used to this day to break up kidney stones. So if you ever have a kidney stone and you go to the hospital, exactly, they will be using high intensity shockwave therapy. Now, not to be confused with low intensity shockwave therapy, which is what the Phoenix delivers. Mm-hmm. Low intensity shockwave therapy is not causing destruction, whereas high intensity does, which is why it breaks up kidney stones.
In the beginning of COVID, they shut all the bathrooms down in the gas stations and most restaurants to the public, and I was having some challenges with my bladder. Yeah. I can go into the details of how I had to nurture it and deal with it, but I was carrying around a plastic bottle and a beach towel so that, I can take care of myself. As soon as I get up, all of a sudden I had to go, and I had to go now. So I was definitely having accidents and challenges and putting myself in embarrassing situations. Like, I was peeing on, the corner of dark alleys and gas stations. And it just, it became a real problem. I didn't want to really do the Flomax drug for that issue as well. I looked into it. I was even prescribed it, and the more I read about it, I was like, I ain't gonna do that. I have had zero problems subsequently to starting using the Phoenix. Zero problems with that.
Wow.
So that was the most dramatic, life-changing part. Frankly, I literally bought this. They gave me a big thing of Flomax, and I've never taken one because of you.
Wow, that's incredible.
Yeah, that is a huge benefit.
Now that you've had both Jada's experience with the Shockwave here at Novus and then using the Phoenix at home, what's the difference to you? Like, pain level, ease of it? Like, how would you describe the difference?
It is a little uncomfortable, yeah, physically painful as well as mentally. But yeah, it is. It's a little uncomfortable. I mean, for sure. It's just there's no comparison anymore because I've done, hundreds of treatments now at home. I've had it, about a year maybe?
Yep.
I mean, hers was definitely more exhilarating. We'll say. So, right? Like I said, I think I've recommended it to my friends just for that purpose. It's an amazing thing. Yeah. And it is uncomfortable. It does have, especially that first time, it's an unexpected sensation.
Yeah.
And so, I get there's a reason why you're using numbing cream.
Okay, so here's my favorite question. When you had the box, right, you were given the box, and you opened the box, were you intimidated?
I think it took me a little bit before I used it the first time. I brought it home and set it in a very nice place in a drawer and went, and then I broke it out. Yeah, it took a little bit. Yeah, it is a little intimidating. There's no question.
All right.
I really don't know how long that takes. What is it about? I've never really done that. I've never paid attention to the clock. When I'm doing that, it has a lot to do with what it is that I am doing.
That's right.
So it takes what it takes. I don't know, was it 20 minutes or something?
17 minutes.
17, yes, that was close. I know, so there you go, yeah.
No, and it's interesting because we have a lot of guys who will say, okay, well, I've done the treatments. I'm where I'm at. Now what? Am I over? Is this done? Like, do I just move on with my life? And realistically, no, because we're still aging, right?
Yeah,
the body is still always trying to break down. So we're just trying to keep it going and moving forward.
Yeah, yeah.
And in case anyone here watching doesn't know, but the statistics show 50% of men over 50 suffer from erectile dysfunction, 60% over 60, and so on. So, it's no secret that this is part of aging and this is just what's happening. We need to start talking about it and not have so much shame behind it because it's part of life.
So then I had to kind of think of it like going to the gym, and having a more regular, routine with it.
Yeah.
That's really what's happening. I'm learning to incorporate it into like a regimen as part of my life as opposed to something that's that I'm going to be always seeking, another prescription or, and putting things in my body that I don't really want there.
What about the penis pump? Do you use it?
I do, not as much as the Phoenix. I've never really. Frankly, Stephanie.
Tell me what happened.
Well, to get that working the way I want it to work, it's it's a little more of a novelty item, I think, is how it feels to me. I don't know that gives me, I don't know what it really.
Okay.
I feel the Phoenix is, because I really don't use it as much.
Okay.
I have it around, but the Phoenix to me is a medicinal instrument, period. And the pump is more of an accessory. I don't know that's, and I know it's a blood flow item.
Right.
And so I know that's important, but I honestly, I don't feel like I need it.
Yeah.
Because
things are working.
My blood flow is pretty good these days, so it doesn't seem to be an issue.
Are you still having to use the Viagra, Levitras, Trimix?
Having to use and enjoy using, I think that it's
changed.
I don't have not one pill at my house. But would I? Yeah, I'd have it around. I'm an impatient person. I ride a motorcycle. I like things to happen fast. So without it, it takes me a little more work.
Okay.
No question.
Yeah.
And then your gel little things are. They're just better, so that's why I came to get them.
So let me ask you this. How many treatments did you actually have to do before you saw changes, not only in your erectile dysfunction, but also in the urination issues?
Well, I'd say after just 2-3 weeks.
Yeah.
I literally, within a month, I forgot that I had the issue with my bladder.
Yeah.
That's realistically the best thing that I have to endorse. because I literally, I ran out of the little bottles that I was carrying around in my car, and it just wasn't a problem anymore. I mean, it literally has gone away. I haven't had to deal with that at all.
So if somebody were to ask you, hey, I saw this ad about the Phoenix, is this a scam? Like, what is this thing? What would you say to them?
If you can avoid putting something in your body that's not healthy for you, I mean, if you read about all the side effects of a Flomax or whatever else they would give you, I suppose, I don't know what else there is out there, but I mean, this is just it's like going to the gym, I mean, it's a physical thing. If you do it and do it right and are focused on it, I mean, I got an almost immediate result.
Yeah.
I mean, it is not the easiest path necessarily, because I had to come to my place of peace with that. It's not great when you go to the gym and you're pushing weights. It hurts and it burns, right? So you're working out.
Yes.
It's uncomfortable physically a little bit, but it's mentally, the benefits are 100%. They're just,
It outweighs it.
Yeah, I mean, they're unchallenged. I mean, it works, period.
I love this. Thank you so much for sharing.
My pleasure.